Thank you everyone for joining today. We're really excited to be here and for me to be leading this discussion, this very important and timely discussion about self-care in the sexual health and reproductive rights space. It's something that I think has been brewing for many years, that people have started to realize the importance of self-care for people who are activists in the space or just people who are accessing services, and to really be thinking about self-care at the very top of the agenda. I know that the WHO put out some guidelines in 2019 on self-care interventions regarding sexual and reproductive health and rights, and that there's a lot of work being done across the space to destigmatize people who are looking to seek self-care. So I'm so pleased to have this amazing panel of people who are across the world. First up, we have Oriana Lopez Uribe, who is currently in Colombia. She is based in Mexico City, though. She is the Executive Director of Balance Promoción para el Desarrollo y Juventud AC, and she's also the spokesperson for the Abortion Fund for Social Justice. So thank you very much. Welcome, Oriana. Second up, we have Laura Ferguson, who is the Assistant Professor of Population and Public Health Sciences at the University of Southern California, USC. She's based in Los Angeles, California. Third up, we have Lolo Cynthia, who is the founder of LoloTalks. She was also an Aspen New Voices Fellow in 2020. So I know her personally, and she's absolutely wonderful. She is based in Dakar, Senegal. And fourth up, we have Viviana Weissman, who is the founder and CEO of Women's Link Worldwide. So yes, we have quite an amazing group with us. I thought that, just to start things off, I wanted to ask all four of you to just briefly introduce yourselves a little bit more, and also chat a little bit about, how you would personally define self-care in the SRHR space, and also why it's important to you personally. So Oriana, I would love to start with you.
Hi, thank you. Thank you for the introduction as well. I'm a Mexican feminist. I'm pansexual, and I work also, I'm a member of research, and I'm a member of Vecinas Feministas. Both of them are feminist alliances from the Global South, one in Latin America and the other Global South. We work from a sexual and reproductive justice framework, which means that social justice is something that is really important for us when we talk about sexual and reproductive health. So that is my approach to what self-care means, and that means that we need to have the tools, we need to have an enabling environment for us to be able to take care of ourselves. So it's not an automatic thing, it's not something that it relies the responsibility only on the individuals, but it's about giving the tools so that people are free to decide and free to choose and able to have options around them to be able to take care of themselves. So for me, we can't talk about self-care in an isolated way. We need to make sure that we're talking, self-care is possible only if we have collective care or if we have community care. And for me, the difference between collective care and community care has to do with how people are organizing themselves. And when I say people organizing themselves, that can be also governments being able to do that work, and institutions being there for the people that they are supposed to take care of. But I'm also talking about collectives and organizations as well. And for me, some of the examples of that kind of approach are the accompaniment networks that exist around the globe, but also very specifically in Latin America, the accompaniment models for abortion. They're based on feminist values, and it's about exactly like having the information, but also being able to supply the medicines that are needed for self-managed abortion. So in that sense, I think that is one of the models that is transforming, and we are, on the one hand, it's parallel. We do want to have a law reform where governments and institutions are taking care of the need of abortion care. But on the other hand, we know that right now there's people that need to have abortions, and those abortions need to be not only safe but very quality and caring, and with all the warmth and community approach that we can in that terms. So it's not only taking care about the abortion itself, but it's also about listening. It's about a centered approach on the person that's having the abortion and being able to fulfill their needs, and also being able to refer them to other services that they need, because abortion is one very specific and small issue. When you see and when you're touching on each other's life, we can see how there are other needs that are there. Violence is part of our context. So how do we make sure that people have what they need in terms of getting out of their houses, or being able to have more resources and tools, and being able to acknowledge and identify violence, these kind of things, but many other things that has to do with family services, how to take care of the children they already have, etc., etc. So that for me is one of the models that I will see as a transformative. Many of those groups are led by lesbians, and for me is also a transformation in terms of these are people that are also like organizing themselves, not because of their specific need, but because they see the need in their community and in the others, and they want to be part of a change of culture that can look at people that can get pregnant in a different way, and that pregnancy doesn't become as something that we are obliged to continue, but rather an option, and that when people come to this world is because they're fully desired, because they're fully welcome, and because they're not a burden, but actually like a blessing. And that is something that is good, and it's gonna change. It's a revolution for the whole world when we all are here because we are fully welcome and desired. Thank you.
Beautiful words to start us off with. And I love this dichotomy that you mentioned, and I'd love to go into that a bit more later about that the between individual action and individual self-care versus the collective, and what's the responsibility of whom. I think that's a really great note to start out on. Laura, I would love to hear from you if you can tell us a little bit more about who you are, and also how you came into this work, why it's important to you, and how you would define self-care.
Great, of course. Thank you. And thank you for the invitation to be here on this wonderful panel. So my name's Laura Ferguson. I'm the director of the program on global health and human rights, and the director of research at the Institute on Inequalities in Global Health at USC. I'm also an associate editor for Sexual and Reproductive Health Matters. So you'll see this theme across my work of bringing together health and rights, particularly in the realm of sexual and reproductive health. And I was actually part of the guideline development group for the global guideline that WHO put out on self-care interventions for sexual and reproductive health and rights in 2019, and again for the recent update. So that was really how I kind of came into this space. And obviously WHO has its definitions of what counts as self-care and what is a self-care intervention. I think for me, the important thing is that there's some separation from formal health services. I think self-care may be a little bit of a misnomer, because a bit like Oriana was saying, it's not just about the self, it's about family, it's about community, it's about any kind of care that is beyond formal health services only. And I actually think that in terms of a definition, it's really important that definitions be locally grounded, because I think that self-care is understood as something very different in different places, and that services, policies, guidelines need to cater to those local definitions rather than there being one that's totally globally applicable. And I think my interest in the area is really the bigger ecosystem that we need in order that self-care can be made available and safe to all the people who might need it. And so that's looking beyond biomedical effectiveness of devices and drugs, but thinking about, for example, what laws exist that may support people's access or create barriers. How do local constructions of gender affect potential access and potential impacts of access? From a rights perspective, how do we ensure the availability, accessibility, acceptability, and quality of self-care interventions for SRH? How do we make sure they reach those who need them most? How do we think about privacy and accountability, which actually is a very complicated one once you're in the community space? Really importantly, information, the right to informed choice, and it again goes back to something Oriana says, we need to make sure that people are being given all of the tools they need to make informed choices about whether or not they want to use self-care. And if they do, that they know how to and they can access support and formal health services if they need additional support. And so I think there's as I say, this whole ecosystem, this whole very wide range of structural and societal factors that we really need to be thinking about when we try and move from a global guideline to something that resonates for different communities. And so that's the piece that really exercises my mind, because I think as soon as you move any health interventions beyond formal health services, all of these issues take on multiple extra dimensions that can be really complicated, but will ultimately make or break what's available for communities. So I'll stop there for now.
That's amazing. I love how you just built on so much of what Oriana said, which I feel like is going to be happening a lot in this panel. I noticed that both of you talked a bit about informed choice and the idea that people should just have access to all the information as well as the services that they need at a given time. Also really loved your point about separating self-care from formal health services. So like, how do we think about informality as it relates to all of this? How do we think about, someone's community coming to them as opposed to people going to a local hospital in order to get to get the services that they need? So thank you so much, Laura. I also wanted to remind the audience, everyone who's listening, that please, if you have any questions or comments to say, that please feel free to put them in the chat. We will, of course, have a Q&A later on. So, but feel free to leave them in the chat. I want this to feel like a really nice, organic discussion, more so than a very formal panel, because that's, I think, often how we get the most out of a topic, especially one as intimate as this one is. Lolo, I would love to hear from you. First, if you could just talk a little bit more about who you are, how you would define self-care, and what brings you personally to the space.
Thank you, Sarika, and it is a pleasure to be on this panel with such powerhouses of women. My name again is Lolo Cynthia. I am Nigerian, the founder of LoloTalks, the community-based organization. We really focus on sexuality education, taking the information down to the grassroots, teaching sexuality education at correctional centers, at secondary schools, and at our local communities. But apart from the education, we also try to ensure that we create a link for the people in the community who need access to contraceptives. So a lot of them do need access to contraceptives, but they don't know where to go to, or they don't have the right information. So we create that link for them. I am also an advocacy officer at NIEL. That's why I'm in Dakar. It's an international advocacy and campaign agency. So that's what I do. And when I think about self-care and sexual reproductive health space, just like what Oriana and Laura has said, is for me, it's all about informed decisions. It's the ability for individuals and communities to just be able to have agency to choose what they do with their reproductive health and reproductive and sexual right, to be able to say, this is what feels good for me right now, and this is what I want to do. It's the conversation of power for me when it comes to self-care. And in my communities, especially when we do grassroots, go to the local communities, when you talk to the women, and I'm really focused on adolescent girls, you can hear that they know what they need, but they don't know where to go to find it. They've seen it on the television, they've heard about it on the radio, maybe they've seen something in the West, but where they are in the local communities, it seems unattainable for them. So I realized that these girls know, and these women know what they need, but they don't know where to go to, they don't have the right information. And in a country like Nigeria, even Africa in general, where issues around sexual reproductive health is shrouded with so much secrecy, and there's a lot of negative attitudes towards this, if you're a young woman and you want to go get contraceptives, for example, you are even ashamed to go to these clinics to go get them because you're afraid of the comments that the nurses, the midwives even would, give to you. So for me, self-care is very, very crucial in these communities and for individuals, because if you are living in a community, if you're living in an ecosystem that has so much negative attitudes over your sexual and reproductive health, having access to self-care interventions that you can use privately in your home is a game changer, and it gives power back to the individuals in the community. So for me, this is really what self-care is all about, and before people, again, like I say, can start to use any form of self-care intervention, I think Laura said this, is that we need them to have informed decisions. What is it that you're actually about to take? Do you know the side effects? Because I know women who go on a certain contraceptive, and when it changes their menstrual cycle, they stop and they freak out, and they're like, you see, those things that they've been saying in the community is completely true. I shouldn't have used it. So ensuring that the people in the communities, before they actually take on any form of self-care intervention, are fully aware so they can make informed decisions on whether or not to use any of the self-care interventions available for them. So I really come into the space of self-care, not just from a community perspective or from the high level. I look at it from an individual level, because individuals make up the communities. And if I go to a family where the mother, the father are still very, shrouded with secrecy, have a lot of social and cultural norms around sexual reproductive health, if I can talk to their 17-year-old daughter who is with the time, who has TikTok and sees what's going on, that's a win for me, because I find a loophole into that family. So I really focus on the individuals and see and believe that working with the individuals will automatically, affect the community as a whole. So yeah.
Amazing. Yeah, I think that this idea of the informed decisions comes up over and over again. The question that I feel like your comments just made me think is like, how do we know when a person has an informed decision? How do we know when someone has I think that there's this NGO-y way to put it of just like, oh, we've, provided so many people informed decisions around their SRHR, whatever they do. But how do we actually know that in a community that a person really does have the information they need at the time that they need it? And not only the information, but they feel empowered and they have the, they don't have that internal stigma, and they can actually go and access the services that they need when they need them. And I feel like that educational piece that you're bringing up and the destigmatization is just so crucial here. Finally, Viviana, I would love to hear from you about who you are a little bit, and also how you would define self-care, I guess building on everything that all of the panelists have said, and also what brings you personally into the space.
Thank you so much, and thank you for the invitation. It really is an honor to be here with all of you. And I feel like I'm getting to cheat a little bit, because after having heard all of your definitions, I feel like I don't have to say that much about the definition of self-care. So I've loved what you all said. So I am. Let me back up. So I'm an attorney by training. And I originally from Argentina, but I grew up in the United States, and then I've been living for the past 20 some odd years in Spain, although I'm currently in New York right now. And I started Women's Link a little bit over 20 years ago with this idea, and it's very in line with what we're discussing today, that there was this huge need to provide tools, legal tools, to advocates in different national spaces to figure out how to get access to rights in national context. So kind of when you look at what are all these legal human rights frameworks that exist around the world, like, the frameworks are good, they're necessary, but completely insufficient. Then it takes the work of all of us, of all of the advocates around the world, working to make these rights accessible to women and girls in the context and where they live. And you've all spoken so much about the importance of understanding the needs within each communities and each context. And a lot of what we do is we work to increase access to sexual and reproductive rights, especially issues of abortion, by using the law. And we work in Latin America and the Caribbean, East Africa, and Europe. And we take on cases that look to either expand or expand how women are able to access the rights to abortion, especially in very restrictive settings where the laws are very restrictive. But also, even when the laws are a little bit better, like who doesn't have access, which is a lot of what we're discussing here today, I believe. And so I think that all I really want to add to this whole idea of the definition of self-care is a little bit the other side of the coin of what does it mean to have informed decisions. And as a human rights attorney, using the law as a tool, and it's just one of the many tools that's available to us. And we look to use the law to do the opposite of what usually attorneys in law tend to try to maintain the status quo. And what we try to do is we try to use the law to break the status quo. How do you challenge the way the law is used and interpreted so that those furthest from access to justice are brought closer to that access? And what we look at a lot is what is the obligation, and I think this is a lot of the dichotomy that you were pointing out. What is the obligation of the states in terms of right to information? Right to information and right to not allow for misinformation and disinformation in these issues that we're talking about. And so we actually have some interesting legal work we're doing with partners. I think I have a couple of examples. If we have time, I'd love to talk about. We're representing Women on Web. And you might know them. They give information about medical abortion, and they've been blocked in several countries around the world. We're representing them in Spain, where they actually completely blocked the website. And we're also have a really interesting case right now with partners again in Kenya, really challenging the lack of information around what was essential medical services during COVID. So, how do you include essential services to women and girls in relation to their sexual and reproductive health and rights during times of COVID? Really pushing for the inclusion of this information within the wider understanding of what information, everybody has a right to have, and it's the obligation of the state to either provide it or at least to make sure that the information that's out there isn't, again, misinformation or disinformation. And to me, the transformative possibilities of self-care, the way it's being defined here, because I do think it has to be defined in this holistic way that you have all already done so, is really very is very powerful and has been, I think we all know, for a long time. We got to work for a long time on application of the harm reduction model, for example, which talks about how do you get information about safe medical abortions in very restrictive settings, and making sure that women and girls have the information, and that you're making sure that you're not putting the woman, the provider who's giving the information, or the institution in risk of criminal prosecution. And we've done a lot of the legal defense work around that, and it decreases maternal mortality and morbidity so dramatically that I think it should be used everywhere. And that's just one example of, I think, the many that we all might have. But really, this, that work was done, I think, started to be done over a decade ago. But kind of coming to the present, what does this mean in times of COVID, where we know that there's been, we all know there's been an increase in sexual violence, as always, as happens in crisis situations, a decrease or a even more difficulty in accessing contraceptions, and then more difficulty in accessing safe, legal, and dignified abortions. And so I think that the conversation about what self-care means now just could not be any more timely. So I'm really pleased to be here with all of you today.
Fantastic. And I love this point that you brought up about information and misinformation. And actually it leads right into the first question that I had for all of you as a panel, which is this dichotomy, or this, this tension between self-care. Does it end up diluting the responsibilities of a government or of, larger institutions, and just put the onus on the individuals in order to figure all of it out? When especially you have, people are accessing information on platforms where the information may not be accurate, and they may not be getting the all of the right tools that they need in order to access the services that they do. So how do all of you think about this, this tension between self-care and the, empowering the individual versus the bigger responsibilities of a state and or of large institutions in order to provide all of the information and services that people need? So any of you can take that and jump in. Yeah, go ahead, Oriana.
Thank you, Sarika. I think that it's changing a little bit of the culture and the system in a way that we have for some many years or centuries, whatever. We have like completely giving ourselves to the medical system in a way that is disconnecting from ourselves, and in that way, it has created I don't know if that was created before, but I think that there's a hierarchy, and you think that medical providers are the ones that need to decide instead of you having the information and them facilitating both the information and the technical abilities. But you should be still in charge of yourself and making the choices and the decisions, and they should be providing you of the options that you have and the information that you need in a language that you understand. And when I say language that you understand, I'm not only talking about the, like if it's Spanish or French or whatever, but I'm actually saying like not in a scientific way, like how can we understand better the diseases that we have and the options that we have for treatments. All of that needs to happen in systems. And I think that there's a lot of structural inequalities that exist right now. It's not like any government, maybe some governments, but with a very few population. But the governments that are facing a lot of people, but also there's a lot of obstacles to reaching to all people, especially those that are marginalized, those that are outside of system, because the system cannot be everywhere, but also because they want to be outside the system. There's a lot of oppression, there's a lot of injustices that has been done by governments. So of course, we also need that to be aware of that and allow people to be outside of the system. In that way, there should be options where you can be facilitated with tools, facilitated with information without necessarily being registered or inside the system to be taken care of. And I think that that's the link that happens with self-care. Like I think this kind of like in abortion, there are many examples of how this can work. Uruguay, before it was legal to have an abortion, they had this risk reduction program where you could come into the clinic, tell them that you were going to have an abortion. They will explain you how to do it. You will figure out how to get the pills. You will do it in your house, and then you will come back and check that everything was okay. This is a way that you're not doing the procedure in the hospital, that you're doing it in a safe way. And it's exactly the same thing that happens in places where it's legal. You go to a clinic and they give you the pills. You go home and you manage it yourself. And then you come back. And the idea of this having to be a medical person or this having to be registered by the government is a way of controlling us. Why do we need to have the number of abortions that people are having? That is a way of controlling us. That is a way of having us in a system where it's extremely personal. There are decisions that you want to take in your own house. There are processes that you want to have your sister around you or your mother or your partner or your friend, and not a medical person telling you that a very sterile process, because it doesn't have to be like that. And it's like having like delivering babies. It's the same thing. It's this idea of how, like in the Netherlands, there's a system that's working where you can have your doula in your home, and still there's an ambulance outside waiting for you in case there's an emergency, and then they take you to a hospital. So it's just building the structure so those like personal decisions can happen, but also realizing that there are some structural inequalities that are there, and there are other people that are filling those gaps. There are many feminist organizations. There are other kinds of organizations that are grassroots and that are actually looking and seeing what are the specific needs and how to like bridge in those gaps and making sure that people have the possibilities. So I think there's one part of like that applies for all, that has to do with actually trusting people with themselves. And I think that is self-care. That for me, that's the value, and what we gain from self-care approach is believing that people can take care of themselves, believing that people are capable, intelligent, smart, and they will figure it out if you give them the options, the supplies, and everything that they need to figure it out. And that is what is missing right now. Even if you are a privileged person right now in most of the countries, the medical system is not allowing you to make your own decisions. What is happening there? So I think that there's a way that these all can have a very good combination to address the specific needs for everyone. But the main point is, how do we trust and how do we ensure, and in order for people to have agency, we need to have everything out there to have that possibility to decide. If we don't have one option, like, what is the agency? I don't have any agency. There's just one option, right? So that is it's the idea is to match it and making sure that the system can allow for everyone to do it. And also, I think that in many things, in violence, in HIV, in other issues, the government is learning from grassroots organizations that are filling those gaps. So I think that is a really good. It's not that we're against, or no, it's that for example, my organization, we work on advocacy. We do recommendations for public policies, but still we are providing access to abortion right now because that's what it's needed. So it's building those bridges because that's are needed right now.
Thank you, Oriana. I love your point also about that there is this privilege gap in this. I think a lot of people who are able to access self-care are people who are privileged, but then there's also people who are accessing it not out of choice, but out of necessity. And I think that recognizing that duality that exists is really important. And how do you make sure that people who are accessing it either by choice or out of necessity, how do you make sure that everyone who does is able to access something with the most dignity possible and with their full agency? So anyone else have anything to say, add? I see lots of hands raised. Maybe Lolo, go ahead. And yeah.
Yes. Okay, I thought I was echoing. I love that question. But when we think about self-care, we think it's this thing that is outside the care. Self-care is just part of the continuum of care. It has to work within the whole health ecosystem as a whole. However, with self-care interventions, we have to be honest that there is a shift in power, because it's no longer the medicalized, person-centered approach. If individuals have the power to choose what they want, then the people in the medical space do not have that much power over them, just like what Oriana was saying. And to be honest, I'm a cynic of the government. I am Nigerian and I'm an African. The government hasn't really been on my side. I do not trust them with my sexual health and my sexual rights. And especially when you look at it from a gender lens, where people in the reproductive system or people in the medical field have predominantly been men, especially people who are medical doctors have predominantly been men. And in a society like Africa and Nigeria, to be specific, where a woman's sexual health is not meant for her agency is for the man. So when you are living in a society where the people in the system, where the people in the organizations are acting against you, it's redundant to think that we can actually rely on them. We did a report here at NIEL to look at the opposition actors to sexual reproductive health in Benin, Burkina Faso, and DRC Congo. And with Burkina Faso, we found that people who work in the medical field are actually the actors against sexual reproductive rights. So if you want to get an abortion, the doctors would stop you from getting the abortion. I can't trust my medical doctor to give me the right information because they have personal beliefs against it. So when you're looking at it from that lens, where the people who work in the system that are meant to protect you are imposing their own personal beliefs on it, and because they have the power to do that, they stop you from accessing your sexual and reproductive rights. It is very scary to think about the consequences of what that means. In my own country, in my own context, it is life or death. If I need an abortion and I can't get it in the medical system, I'm going to go to a backstreet abortion clinic. It is what it is. And with abortion, it is like it's the big thing. It's the one topic you don't talk about. You can talk about contraceptives, but when you talk about abortion, then all hell has let loose. There was a time I put out a post on just talking about medical abortion, like Oriana was saying, and talking about the drugs and linking resources. Like, women, these are the resources you can get. You don't need to go to a hospital. And I think Nigerian Twitter shut down that day. the medical doctors were calling for my head, that it should be a crime for me to give out these kind of information. And all that just reminded me was that they realized that they don't have that much power over the individuals anymore. People don't want to be in the system. People want to be able to have their own rights, to make the choices that they want. And just like Oriana said, with this hierarchy there, when you're trying to fight against a system, when you're trying to fight against the power, there are obviously going to be critics. Sometimes the government would put policies in place to stop you from having the right of your own sexual and reproductive health. So I think we need to look at it from both lenses, yes, not see it as the government versus the individual, but see it as a continuum of care, but also be skeptical. You know, we have to be skeptical and look at it and say, these policy that is being put in place by the government, who does it serve? Does it serve the women, or does it serve the government in power? Do they want to still have control over women's bodies, over our reproductive health, over our reproductive rights? Because as developed and liberal as the world is headed, we live in a society, in my own country, we're still in a bit of a bubble. There are still patriarchal social norms that are so deeply embedded in the way that people think, that the only way that we can actually get out of that is to empower the individuals to shine light in little dark spaces, so that when we all come together, it could be brighter. So for me, it's a question that's interesting, but it's also very funny, because Nigeria and Africa is also a country or a continent with underdeveloped healthcare system. The doctors don't have enough skill sets or don't have enough capacity to deal with the number of patients that they are seeing. So how about you pass that responsibility to the individual? It's just another form of task shifting. But you know, again, when you're thinking about power and you're thinking about privilege blinds. You don't want to see the other aspect of it, because you believe now you're not going to be needed in those situations anyway. And again, everything I talk about goes back to power. Even with the way the doctors write the medication you need, in the handwriting that you cannot read as the patient, and they tell you, no, don't worry, give it to the pharmacist understands. No, I'm the patient taking the medicine. I need to read what you're giving to me. It's in the little things that the issue of power comes up, and why self-care is very, very crucial. So yeah.
Sorry, that was muted. Yeah, I'm just like finding myself just nodding along to everything you're saying. Viviana, I saw that you also had your hand raised, that you wanted to add something.
Yeah, and so to Laura, I don't know if just quickly, I just want to say that. So I very much agree with what Oriana and Lolo both said. I think that there's this point Oriana made. She talked about like, because you want to be, she was talking about being outside of the system and what it means. Like, and so like this kind of a little bit of this false dichotomy. And Lolo's also like, it's a continuum. And I think that is like the way that we need to look at it. It's so that we don't create like an or scenario. It's an and scenario. That said, I think for me, the interesting framework of looking at it within a human rights framework is like it doesn't matter whether you're inside the system, whether you're, however that you're walking towards the healthcare that you individually need, you have your basic fundamental human rights. It doesn't matter if it's within the medical system, outside the medical system, like it's all within the framework of what those fundamental human rights are. And I think sometimes we forget like that human rights are based on one fundamental idea that we cannot lose sight of, which is human dignity. And lack of access to your fundamental human reproductive justice, rights, health is a lack of human dignity. Like that's everybody's right. It doesn't matter where, it's a right that we are all literally born with. And so I think if we could like back up and look at it within this framework, then we can also embrace this idea of it being within a continuum, whether you want to get your services inside or can want to get your services inside, can want to get them outside. And it's all these issues of privilege. And then I think that's fundamental. And I also want to say that this idea of putting really forth that we are talking about, I think Lolo says, is a shifting of power until we like come full term to realization that we're talking about a shift of power. It's the same thing when you're talking about gender equality, equity, like it's a shift of power. And so you've got to recognize it, because unfortunately we're talking about medical medical, like legal systems, they are patriarchal, like per se, the way they're developed, the way that they carry out. And so we are like swimming around very patriarchal, racist, colonial systems. And so the recognition of the need to shift the power is just, it has to be the beginning of the conversation. I couldn't agree with that more. And I think that the other two things I want to say in terms of thinking about kind of potential like risk or looking at the self-care model in this comprehensive way we're thinking about is remembering the disproportionate burden that women face in terms of care and generally in the care industry, the health. So like if you don't put that in there, because like you don't want a self-care model that doesn't recognize that already disproportionate impact or like burden that women face in care generally, including in healthcare. And then also, and I think that at least one or more of you mentioned this when we were first starting to talk, is this discussion also has to be framed within the unacceptable levels of violence, sexual violence that women and girls face. And I think not doing so also makes the conversation kind of difficult to be completely real, because so much of what we're talking about in terms of access to health is unfortunately directly related to the levels of sexual violence faced by women and girls globally. And so that's, I think there's another part, like I think for me, like when I think about like risk and things to be aware of, that's the other factor that comes into my mind.
Yeah. Thank you so much, Viviana. Laura, do you want to add anything to this discussion?
Sure. I mean, I feel like I have to, and I'll try and be quick. So I know there's a lot that we would like to get through, but yeah, I mean, really just building on points that have been made. The issue of power is obviously critical, and I think we need to think about it not just within the health system, but also within the community, and see who are the most disenfranchised within communities and what are the additional barriers that they face in order to access self-care, because there are structural barriers in both of those spaces, within the community and within the health system, not to mention the legal system and other spaces if we want to go there. And so I do think that there's, that's a massive challenge that we need to just keep trying to better understand and trying to shift. And obviously that takes time. We're talking about systemic change. And back to the parallel of some people choose to access self-care outside the formal system. Some people don't have a choice because the formal system doesn't respond to their needs. We need to be responsive to both of those situations. And so that probably means immediate action in terms of reaching those who feel they have no choice and no ability to access formal health services. But when we think about the involvement of the health system in the delivery of self-care, it's not, to me, it can't just be an abdication of responsibility. It may actually take more time and effort from the health system in order to set people up to be able to use self-care with the kinds of information that we want people to be able to have. And so I think that, there's this tricky balance here of like, we don't want to keep power in the hands of medical professionals. At the same time, they do have an obligation to be providing information and services. And so how do we shift the conceptualized role of health providers so that it's less about them keeping control of all of that, but providing the information so that people can then go off and do what they do and get the support when they need to. And so that's going to be a really uncomfortable discussion with lots of health workers, but I think it's one that we need to have in order to make sure that we're promoting the kind of autonomy that we hope self-care can promote. And finally, the other structural issue, which I think is really important to address in this, is finance. If people are accessing medications, diagnostics outside of a health system, they should not be incurring costs that they would incur if they were to access the same things within a doctor's office, right? Because again, that just creates an imbalance. And so it's another unpopular can of worms, but how do we rethink health financing to ensure that we can make self-care available within communities at the same cost, which ideally is no cost, as in health facilities? So again, I mean, lots of very large and structural issues to think through.
Yeah. Yeah, you've all brought up such amazing points. We only have 20 minutes left of this discussion. This time has just flown by. I'm going to ask, we have a few questions in the Q&A section. I will ask one question that I had that dovetails with one of the questions in the Q&A, which is about any specific tools or examples that you've seen, any technologies or maybe non-technology solutions that you've seen regarding self-care that can really help that can assist in expanding self-care options. Laura, do you want?
I mean, I can, yeah, sure, I can jump in on this. I mean, I think that self-care is expanding incredibly rapidly, and that's in part because of technology. You know, I was talking to a colleague in Kenya yesterday about an app that helps women monitor their pregnancy throughout the pregnancy, and so without going into antenatal services, they can have a sense of the health of their pregnancy, the health of the fetus, and their own health. And so with tools like that, you are able to put some more decisions in the hands of people in the community. We're seeing a lot of expanded use of artificial intelligence, honestly, in ways that concern me in some ways. There's a lot of rights implications we could talk about that, but also in some really good ways, in some really phenomenal ways of how do we use this big data to better understand risks and to better understand who's not being reached, and to inform sort of those policies and interventions that we really do want to have in place to reach those being left behind. So I think that the really, from a technology point of view, there's immense rapid change that's happening. But again, I do think that there are non-technology options as well. And I think that comes back to how we define self-care and how every community defines self-care and what's available to them. Maybe traditionally, right? Maybe more recently as societies have evolved, that can help support this notion of self-care, community care that's outside of a health facility. So I really think we need to see self-care as a fluid notion, both technologically and societally and socially as well.
Yes, Lolo. I'm sure you have some ideas also regarding stigma and education for younger people.
I thought Oriana was gonna go. Okay, just just to build of what Laura said, that I do understand that there definitely needs to be some community kind of self-care. But with the way the world is moving into a technologically driven right now, the use of mobile phones, I believe in humanitarian settings and underdeveloped countries, is going to be a life changer when it comes to self-care interventions. You know, when you look at the app like WhatsApp that uses very little MB and has one of the highest penetration in Africa, with like the top three, over 95% is Nigeria, South Africa, and Kenya. Like all three are African countries. They show you the power that, you know, smartphones and applications like WhatsApp and Facebook does have. So I believe that as we are thinking about self-care interventions, if we cannot reach everyone at the community level, what are some of those tools that are already available to us that we can take advantage of, especially with COVID-19? I mean, during the ongoing pandemic, because I can't even say it's in the past, we saw how important it was for people to have access to self-care. And the only way they could do that was through tech. You know, in Nigeria, the domestic response violence team, they realized that they could not reach the women in domestic abuse cases. But what those women could do was like send them a message through WhatsApp or through a hotline, and they were able to reach out to them. So even in gender-based violence cases where it might be life or death, if the person who is physically or sexually abusing you see you going to seek for help, if you have access to a mobile phone, a WhatsApp line, a message, you know, the person on the other line is taking a very simple name, a girly name, just to disguise who they are. I believe it can be very, very beneficial and can be very, very crucial, especially, again, in underdeveloped and humanitarian settings. So that's just really one thing I was thinking about. And the app Flow, I mean, who doesn't use Flow now? I'm sorry, I'm not even a stakeholder, but the app flow, you use it to count your menstrual cycle. These are things that before you go to the doctor's office and they ask you, when was your last menstrual, and you start calculating, and people that don't even know. But the fact that there's an app that just guides you, that tells you you're ovulating here, this is what is coming up. Oh, you're having pimples. This might be the reasons why you're having nausea. I think it seems very, because we're living in 2021, the fact that you can get such information seems like we don't see how important it is right now. But if you look back 10 years ago, 15 years ago, we could only dream about these kind of information being at the tip of our fingers. So those are just some of the ways that I believe that we can really take advantage of technology in underprivileged, in underdeveloped, and humanitarian settings.
Thank you. And Oriana, you were going to say something.
Yeah, I think I'm gonna say many things all over the place, but one of the things is like, yeah, there's apps, but I'm very critical of apps. I am sorry for that, and I think it has to do with what Laura was saying in terms of what is the data that has been like. What are the kind of data that you're giving to these kind of apps? So this and there's a way that you can see, and there's like these audits that tech people are doing on these apps in terms of what kind of sharing to third person that are happening that you don't know. For example, with some of the I'm not saying anything against Flow because I don't know if that's a specific app that does it, but menstrual cycle apps. Often what they do is they provide your information to people that are want to sell you things, to companies that are selling you stuff. So that is one of the things that are like really worrying about the apps, is like what kind of information is out there. Some of the apps that I know that they are safe is Clue, for example. And it gives you all the tracking that you need, etc. I'm not sure about Flow in particular, but there are many apps that have been developed for abortion to support people on self-managing abortions. And what we have learned from those apps is that they need to be very context-based. That that there's also someone, a human, that can be contacted at some point. So it's not only like very cold information but that you can actually, because we are people and we react better when there's a warm person on the other side telling you that we're all going to be okay, and then our body actually relaxes and everything can flow and flow the way that it's supposed to be flowing. And so that's one thing. But the other thing is that I think that we still need to think about the other tools that exist in the social networking. No, it's not about social media, but this idea of the social fabric that we can still make, and being able to organize ourselves for community and for collectivity, and to be able to take care of in a different way. For daycare, like how do we, like in a community, how can we organize ourselves so that we can, like have those kind of things, like a community kitchen. Those are still very relevant in a lot of our contexts, and we need to go back to those practices that we used to have as a society, and remember that that's a way that we can have a breather. Is have a community kitchen, allow for some people to breathe one day and to work the other, and that is some way that we can take care of each other. I think that there are many manuals, and on self-care that has to do with knowing how the herbs work and how knowing about other things that are practices that are still part of our roots, that are bringing us back to the land and bringing us back to nature and bringing us back to a different contact with our bodies and with our planet. And I think that those are also very valid. I'm not saying that people shouldn't do any kind of like a Western medicine, I'm going to call them, but also bringing those traditional practices that are part of our cultures and that are part of our roots, I'm going to say again. I think that the social fabric is very important, and a very specific tool, and has to relates with some of the questions that have to do with the US, is the abortion funds. And I know that I have an abortion fund, so and I'm speaking on behalf of that abortion fund. But the abortion funds in the US exist precisely because of that, because there are many barriers that are in place to get access to abortion, and those abortion funds are like savvy people that are there to help you navigate when you need to concentrate on your personal decisions. They will help you navigate the system, and those are examples of tools that are there. The networks of accompaniment for abortion in Latin America, the abortion hotlines around the globe, like those are tools. Self-defense classes are tools also to navigate a world where gender-based violence exists and where you can be harassed on the street, on the public transportation, etc. Those are tools as well. So just making sure that we have like a human community component into the self-care, because it's not supposed to be what the neoliberal model is telling us, that self-care means getting a massage, going to the spa, and getting our nails done. That is not self-care. And self-care is about taking care of our communities together.
Yeah, thank you so much. And yeah, thank you also for differentiating this from the going to the spa and getting your nails done, which is, important element of self-care for many people. But I mean, it feels like almost farcical to put that in the same category as, self-managing an abortion or taking a self-defense class against gender-based violence. And all of those, are still to protect yourself in some way, or, to heal yourself in some way or the other. So one of the, or Viviana, did you have anything you wanted to add on tools and technologies or non-technology solutions? Okay, so one of the other questions that came up in the Q&A is about how so much of SRHR education and outreach seems to be directed towards girls. And are there ways that we can engage boys in around questions about agency and self-care, or boys and men? Yes, Lolo.
I feel like I always win the game. I raise my hand and Oriana opens her mic. So it's like, okay. Everyone asks that question, and I think it's very important, because if we teach girls how to say no and we don't teach boys how to respect the no, there's going to be a problem. That's the template for violence right there. And when I do my sexuality education, we teach both boys and girls. Sometimes we have mixed classes and sometimes we have same-sex classes, because it is important to create a room where people can speak freely. However, I believe due to the prevalence of gender-based violence in our society and the low self-agency and self-esteem of young girls, we really put a lot of focus on building the confidence of young girls in our society. But it is very important to ensure that we are including boys in these conversations as we move along, so that they can also, because with the boys, it is a blind spot. Now, I'm not talking about the men who have grown up with this patriarchal mindset and they're so stuck in it. I'm talking about a boy who is 10, 11, 12. There is a blind spot in his conditioning, because he doesn't live in a vacuum. He's part of the greater society that continues to reinforce a certain narrative of who he is as a man, who he has to become if he wants to be respected as a man in our society. So when it comes to sexual reproductive health and outreaches, I really believe where we are in our society, the power of media plays a huge role. When we go do our outreaches in the community, you'd be surprised that if we call the men and the women, the people who come are the women. The men would see these kind of roundtable discussions as things that are inferior to them. These are things that are not manly, in quote. And it just perpetuates that narrative that, when it comes to self-improvement, when it comes to self-care, it's a woman thing. Even when we look at it in the society now, a lot of women are getting educated. When it comes to self-improvement, we see the way women are pushing to become who they want to become, who they want to be. But boys are still stuck in that narrative or in that box of who they think they're meant to be 10, 15 years ago. So if we can reach them through outreaches, sometimes we have to force them, but if we can reach them through these community outreaches, how can we leverage the media? How can we leverage pop culture to infuse this conversation in, popular with a sex education show that came up? I know how impactful that series is on young boys. There are things that they would never discuss with their boys, but when they watch these shows, it's embedded subconsciously in these conversations that it pops that blind spot in their mind. So I believe it's very important to include boys in this conversation. I understand the advantage that girls have in this situation, because we are trying to build the self-esteem of women in a society that continues to perpetuate a narrative that they are inferior to men. But I believe that one key way that we can do this to reach boys is to use media, is to use their pop culture stars. Boys, boys and men, they're just things that they love. They are stars that they love. They are shows that they think is beneath them. When it comes to even there are certain educational things that we put out there. I have consent toolkits. I have sex education toolkit. Who are the people downloading it, even if it's free online? It's girls and women, you know. So we need to talk to the boys and say, what do you like? How can we use what you like to get you to change your behavior? Who are the people in your community that you respect that we can talk to, that can even mentor you boys to change your behavior? So we women, I as a woman can go into the community and talk to the young boys to change their mindset, to get them to see the agency of themselves and also of women. But I think it's also very crucial if we partner with men to do this, because men listen to men more than they listen to women. It is sexism 101, but if it's something that we know that works, how do we take advantage of that sexism to push the narrative that we're trying to push? So I will say reach out to men in the space who are eager to work with young boys, and also reach out to, in quote, popular figures who are eager to change the narrative, and they know that these young boys would listen to them because they are literally their mentors. So that's my 2 cents on the conversation.
Yeah. Really quickly before I go to Oriana, number one, I'm so glad you brought up Sex Education, the show. I just actually finished watching it a few days ago and found it so informative in so many ways. And I wish it was the sex education that I had when I was younger. But I feel like also what I'm hearing you say is that there seems to be a dichotomy between the types of education you provide to boys and men who don't really want it and don't really want to be involved. But then there's also, I think, people who actually actively want to help their partners as they're going through an abortion, as they're going through a really tough time. Like, how do you, are there resources that are there for them so they can be better allies and better partners and better community members also, if if there's a boy or man who's seeking out this information. So I think there's like a bit of both that needs to happen. Oriana, I'll let you go.
Yeah, and I think that there are a lot of memes about that kind of thing, no? Like abortion being something about women, but then men are taking, making those decisions, and those are the stakeholders that are hindering women. So how can men become allies? And I think that in Balance we have 2 kind of publications for men and abortion. And one has to do with when you're an activist, when you want to be an ally from that part of like transformation around the world and around the culture, because I think that it's a cultural change. And the other one is what kind of ally can you be for your partner or for your close one, right? Is your daughter, is your friend, whoever, but how can you be a good ally and not an obstacle? Sometimes it's an obstacle because they become so scared and afraid of the blood. And it's like, I bleed every month. Like, what are you talking about? But I think, more of that. But I think that also, and agreeing completely with Lolo, I think that's a part of comprehensive sexuality education, to actually change the gender stereotypes, to actually challenge the power structure that's there. And it's really important that we are providing that from early on, but also understanding that people, like the grown-ups, stakeholders, Congress people, has not been having CSE. They don't know about comprehensive sexuality education. They don't know about gender stereotypes. And it's really important language. It's gender-based violence. That doesn't mean that it's violence against women and girls. Gender-based violence means that it's affecting every one of us, because it's placing us in a box that's very stiff and nobody actually fits in. And it's hindering and it's harming women, yeah, but it's harming also men, and it's harming people that are in between, that are neither men or women. And we need to acknowledge that they exist for once, but also that it is affecting all of us. That feminism is not about improving the world only for women, but it's improving the world for everyone. We are, as feminists, reaching out for a better world that is allowing us, and is making a liberation of ourselves, and it's allowing us to be whoever we want to be and however we want to be. And that doesn't mean that we have less power, less voice, less agency. Or less bodily autonomy or less control of ourselves. So I think that we need to start to change the narrative of this binary and start involving everyone. And feminism is about improving the planet, not about improving only women's lives.
I love that. Feminism, that feels like it should be a t-shirt. Feminism is about improving the planet. So it's we're actually at time, which I can't believe how quickly this has gone by. There were so many other points I know we all wanted to raise. I think it just underscores what an important discussion this is, and what a deep one this is, how it touches so many elements of sexual and reproductive health and rights. So thank you all so much for being here today. And for everyone listening, you can find all of these fantastic panelists on social media. I'm sure their handles, maybe if you want to just drop your handle in the chat where people can follow you and see more of your brilliant work. And I believe there's now going to be a musical performance, which is exciting. So that's going to be on the main stage. And then after that, there'll be a networking session. So thank you all again so much for joining today and for sharing your incredible wisdom. And I look forward to collaborating with all of you very soon.
Thank you for having me. This has been an incredible chat. Oriana and Viviana and Lauren that dropped off. We need to connect another time outside of
Yes.
us. Okay.
Happy to have met you all. Thank you.
Bye.
Thank you all.
Likewise.
Bye.
Thanks, everyone.